So I want to go over the Concierge tab in Bed Tracker. So if we're at the dashboard, we'll head over to Binders and we will hit Concierge. The reason why we put Concierge into this platform is because we noticed a lot of facilities were moving towards having concierges in their facilities to help with customer service, resident satisfaction, family satisfaction. So we decided that we would put together a nice comprehensive platform where the concierge could document and show their work that they're doing, as well as for administration to be able to see from anywhere how their facility is doing when it comes to resident satisfaction. So I'll go over the process of how it works when a resident comes in. Just note that you won't have to input any residents into the platform. It will pull straight from your EMR system. PCC is the one that most facilities have. So when a new resident gets admitted into PCC, so the way we set it up is that there are 3 surveys that will happen. So day 1 of admission, let's say we'll hit today, we'll do Robert Smith. I'll just give you an overview of what the survey is. So day 1 survey, we'll ask them, how do you find the admission process? And we'll have the concierge write a note. How would you rate the admission process? Do you feel welcome and supported in the facility? How do you feel your room is set up so far? Do you need help with any paperwork, whether it's if they're long-term stay and they need to do a Medicaid application, or obviously admission paperwork, we'll be able to help them do that. Day 2 survey, it's how was your first night in the facility? Did the staff introduce themselves to you? How was the food? Any activities you like in particular? Is there anything that's not working properly? Because a lot of times the TV doesn't work, and we find out 3 days later the resident wants to leave because they don't have a TV. And this could be avoided if we just ask the questions. And then is there anything else I can help you with? Do you need something that you're currently not getting at the facility? And then the day 3 survey is again, we want to know how their night went. If they had a chance to go to activities. How are the nurses, CNAs? Did the DON come in to introduce herself? Did you get a chance to maybe take a shower? How's the therapy going? If they're on therapy, if there's anything else that they need. And then weekly, they'll be getting a weekly survey that I'll show you what it looks like. Let's look. So this is the weekly survey. So the first 3 days they come in, they get those 3 surveys, and every week after that, they'll get another survey that the concierge will do with them. Or if you want to set it to every 2 weeks, we can do that if you have a larger facility. How would you rate the food? How would you rate the nursing care? How would you rate the cleanliness of the facility? How would you rate the responsiveness? How would you rate the activities? Do you have any concerns or issues? Is there anything that we could help you with? And all that will be put into a rating that you can kind of see, who your low rating residents are, and kind of you could view the history, why they're giving you why you're getting that low rating. This way, if you're anywhere in the world, you could kind of see what's happening at your facility. Also, you'll be able to let me go out here. You'll be able to see who recently rated you poor. So let's say if there's a resident that gave you 5 stars for the last 10 weeks, and now he's giving you a bunch of you're getting 2 stars. You could see exactly, maybe he just hates the food and his roommate, so that's why you're getting low rating. You'll be able to correct that without it having to go to a grievance or them family members getting upset. This way you'll be able to just be able to see that. So basically the goal here is for resident satisfaction and a place for concierge to document, and a place for administrators, DONs, regionals to be able to look in and check in how their facility is doing. Over here you'll see an overview of all the different surveys, and be able to see what they're rating you, what they like about the facility. You'll be able to see, like, if there's a certain day that you get a bunch of low ratings for the food, you'll be able to be like, okay, who cooked that day? Maybe the residents don't like fish, or maybe they had chicken 7 days in a row and they don't like chicken anymore. Or maybe the cook is just not a good cook. He doesn't know how to cook. The food's not palatable. So you'll be able to really focus on the customer service and the resident experience at your facility with this tool, and that's what we aim to do. There is a little bit of customizable if you want specific questions in the 3-day survey when they get admitted first. we can do that. But this is a tool to help customer service mitigate complaints and have concierge actually be doing their job, as opposed to just, they come to the facility, it's a great idea, but they're writing down issues on a piece of paper. Here it's documented in our system, so it's not on the EMR. The state has no access to it, and we can mitigate the issues from here. You could see it. You could sit at your desk and go through all your complaints and figure out what you want to do in all those scenarios. So that is the overview of the Concierge platform and bed tracker.